is Julie Pedretti. I'm president of the Press Club of Southwest Florida. So good to have you with us today. We had hoped to meet in person, but unfortunately, we're having to postpone our first meeting to December. We'll talk more about that later. Again, please stay muted for through the program. If you have any questions that you want to ask our panelists, put it in the chat box for us, please. Our Zoom host, Press Club board member Tom Marquardt, will mute you if you haven't already muted you. And Tom, thank you for helping us out today. First, let me just give you a brief overview of what the Press Club of Southwest Florida is all about for any of our guests. We are an association of active and retired journalists and other media professionals that encourage excellence in journalism and journalism education, networking, engagement with newsmakers, and community service. The mission of our 150 member group, which is now celebrating 25 years, is to advocate for quality journalism in all of its forms, print, broadcast, and digital. We actively defend both the First Amendment and the public's right to know. Our further goal is to support journalists of the future, and we've got a wonderful scholarship program for journalists, and we also mentor them. Again, while we had hoped to meet in person today, we're pleased to offer an alternative way for our members and our guests to get together virtually for a timely presentation about how partnerships are helping to address increased health disparities due to the pandemic. So first, let me quickly introduce our facilitator for today and our guests, and then we'll jump right into the program. Laura Grenius, a member of the Press Club board, is an editor with 30 years of experience in newspapers, magazines, books, and digital media. In her first year as the Florida investigations editor for the USA Today Network, stories that Laura edited won 5 awards, including Investigations and Freedom of Information. She's got a very, very interesting background, but just know that she spent 15 years at the Los Angeles Times, where she was an executive news editor and deputy front page editor, foreign news editor, and morning assignment editor on the city desk. Laura, could you wave?
Hey, thanks for having me here today.
Good to have you, Laura. Thank you. One of our panelists today is Jude Beauchamp, and he'll have to correct me on the pronunciation of his last name. I'm trying my very best, Jude. Jude was recently named Senior Project Lead, U.S. Public Health Accompaniment Unit with Partners in Health. He's located in Milwaukee, and he's leading Partner in Health's, we call them PIH, by the way. PIH is collaborative work with Healthcare Network, the Coalition of Immokalee Workers, the Department of Health Collier, and other community partners to improve health equity among migrant farm worker and other underserved and vulnerable populations. He previously served as the TB and HIV lead in Liberia and also has worked extensively in Haiti. Jude?
Hi, everyone. So thrilled to be here, and thank you for having me. You got it right, Beauchamp.
Next, we have Gerardo Reyes Chavez. He's a key leader of the Coalition of Immokalee Workers, mobilizing communities across the world to advocate for the rights of exploited workers. Through CIW is how we refer to them, CIW. Through CIW's Fair Food Program, Gerardo has facilitated unique partnerships among growers, farm workers, and retail food companies to ensure humane wages and working conditions for farm workers. Gerardo.
Good morning, everyone. Thank you for having us. Really looking forward to thinking together, on these topics.
Thank you. And finally, well, I guess not finally, because I'll introduce myself as well, but our next panelist is Erin Birney. She's the outreach coordinator for the National Center for Farmworker Health. Through documenting and sharing promising practices, technical assistance, and health education material, Erin provides support to outreach teams nationwide that are working to prevent the spread of COVID-19 in agricultural worker communities. Erin.
Hi, everyone. Good morning, good afternoon, Floridians. I'm excited to be here. Thank you.
Thanks. And I do serve as the final panelist. I am the Vice President of External Affairs with Healthcare Network. I'm responsible for marketing, development, and community partnerships. And I joined Healthcare Network to run the COVID-19 team, started the COVID-19 team last June. So I've been on board just over a year. So let me just start with a little bit of background, and then I'm going to turn it over to Laura to facilitate our panel. Immokalee's 27,000 residents, are primarily involved in growing and packing fruits and vegetables. And in fact, Immokalee was once known as the world's largest producer of tomatoes. I think we're still right up there, but when the COVID-19 pandemic hit, people in Immokalee struggled as they had 2 years before during the devastating Hurricane Irma. With COVID-19, culture and mistrust, language differences, low levels of literacy, lack of technology, little to no transportation, and concerns about documentation of migrant farm workers created significant challenges in educating and protecting the community. Early on, as you probably read, positivity rates, COVID positivity rates in Immokalee were as high as 30%. They were so bad, in fact, that Doctors Without Borders, who typically does international work, and Partners in Health, another organization that serves international populations, came to Immokalee to assist with problems that were identified by the Coalition of Immokalee Workers. They invited them in. The National Center for Farmworker Health also reached out to offer support through grants. So each panelist is going to provide some details about their organization and then answer questions from Laura. So Laura, I turn it over to you. Thank you.
Thank you, Julie. All right, I am really excited for you to hear what these three have been doing here in Florida, and especially Erin's perspective from being outside of the state from the national. I had said I was going to start right off with Erin, but I'd like to go to the three of you first and have you talk about this very unique partnership that you put together during a crisis and how you were building it as you were flying it. And then Erin, I'm going to go to you and ask for your national perspective on this. It's really how unique it was, and then circle back around for, is this possible for other communities, especially in smaller communities? So Julie, can I just toggle right back to you and have you talk about your part in your organization and what was unique in reaching out to the other two?
The start of the pandemic brought opportunities for some grant funding for Healthcare Network. Healthcare Network serves all of Collier County. We provide primary care and we take care of a lot of the underserved population. We received a grant and the executive team decided to start a COVID team of community health workers. And as part of pulling that together, Partners in Health, who had just come into the community, I think in May, and the Coalition of Immokalee Workers both quickly became partners in providing some education to the team about what was going on and how we could be helpful, and providing access to, especially Coalition of Immokalee Workers, access to the farm worker population, helping us build trust so we can provide education around COVID in 3 languages, by the way, in Spanish, English, and Haitian Creole, provide education and get people tested, and then make testing more accessible because at first it was not. So the partnerships evolved rather quickly, but had not really been in place prior to a crisis. And I've said this many times before, the one really good thing about the pandemic is it's brought our organizations closer together to do more for the Immokalee population.
Thanks. Jude, do you want to step in next?
Absolutely. Thank you. Again, as Julie mentioned, Partners in Health, PIH, we are an international medical social justice organization. We work in 12 countries now, with what we call our 5 S's strategies, which is space, helping government building their hospital, staff, providing training, medical training as well, like residency training for staff to have well qualified staff. Staff bringing materials, biomedical materials, what they need. Social support, which is our biggest one. We have a well-extended community health workers, what we call CHWs, which is our army, our backbone in everything we are doing. And system, because with everything we're doing, partnering with people, our end goal is to make a better system. So when we got here in Immokalee, I would say this is the dream team with CIW, Mission Peniel, HCN. This is the dream team with Partners in Health bringing like more the social approach, CIW, the justice, the healthcare, like the white approach, and HCN in the middle, giving us the platform to do that. And I think we were able to bring the biosocial approach, I would say, in our work, because COVID-19 is another reminder that just the biomedical approach may not be the right one, because we tend to presume that patients, they will come to us. Patients will always be able to do whatever we prescribe them. That was not the case with COVID. For instance, when we told them to quarantine, many could not because they have to go to work. This is just an example. So this partnership was unique in the region. We were able to provide care, to do canvassing, to go to people, to do door to door, and also provide the social support they need, for instance, to stay quarantined humanely. And this worked. So I think it's unique, and it can be a model to be extended in other undeserved or struggling communities. Thank you, Laura. Over to you.
Thank you. Gerardo.
Well, for us, I think that as you were mentioning, we have been working to improve wages and working conditions. Our framing has been on human rights since the Coalition of Immokalee Workers started, or CIW. We are led by our community. I'm a farm worker. Most of our staff come from that background. And that is precisely what gives us the edge that we need to be able to bring ideas that will land in our community. Because we know how it feels, we know how it feels to be ignored. We know how it feels to be poor, to be vulnerable, to be hungry, overcrowded, and not protected. And we have fought since the beginning to be able to change that. We have been able to now land the Fair Food Program, build a system in place to protect workers in terms of their human rights, but also in terms of health. In times of COVID, we were able to create inside the Fair Food Program, that's how we call it. It's a collaboration between workers, 14 of the largest corporations of the retail food industry in this country, including Walmart, McDonald's, and a few others. And the growers represented under the Florida Tomato Growers Exchange, which represents 90% of the industry. And it's now this program being implemented in 9 states. I mention it because that's where we are coming from. That's our labor of more than 2 decades. And now we're collaborating to implement changes inside these farms. So we have these protocols. In the community, though, we still have the same vulnerabilities everywhere else and in every other crop, same vulnerabilities that I was mentioning. People living with a lot of other people, not being able to observe any of the recommendations coming from the governor, for example. Resources were not being directed to Immokalee right from the beginning. So we offer our help. We offer to volunteer all our skills, all our organizing efforts from the very beginning. And then we saw the need to create something alternative because it wasn't working as it was. So you mentioned, we started to collaborate with Doctors Without Borders, and our community was, I think, the second zip code in terms of like positivity rate, how high it was in regards to COVID. And we realized that to be able to build something that makes sense, really what you need is the people who are suffering the most to be part of the crafting of that, because they are the ones who know what it is that is failing. Many people will tell you, like in the past, I mean, our health has never been taken as something that is key for us to be able to do our job. It's almost secondary. Ourselves don't go to the doctor because we want to be able to save money and send money back. So that the space of vulnerability always pushes us to basically bet against ourselves sometimes, but it shouldn't be considered our fault. As workers, we produce the food. We are essential only by name. But at the end, we live in this contradiction in which in one end, we're told we're essential, but at the same time, we're not given the resources that were needed. That's what brought us to collaborate with the Department of Health, the healthcare network, Partners in Health. Right now, this model incorporates the economic side of things. Mission Penel, for example, their job is that social support, right? And we encourage people, like if you want to support Immokalee, there's this way of doing it. You support Mission Penel, and we coordinate to be able to animate people to talk about their needs in these moments. People trust that because they know it comes from the community, it comes from the coalition. And along with that, with Partners in Health, for me, it's just incredibly satisfying to know that in a community where we were given at the very beginning, when we had 500 vaccines, that we were going to directly be involved in this partnership with you all. It was from one day to the next when I think the Office of Nikki Fried told us that they were working on that, and that was made available for Immokalee. With 1 day of anticipation, we were able to bring about, I think, 450 or 500 people the next day. At the same time in Tampa, they were reporting that people did not participate as much. And in other big cities, Immokalee became an example. Now, how a community of poor people, the most disenfranchised, the poorest, we don't speak English for the most part. I am an exception in that. In regards to all the things that limit us, the one thing that makes us stronger is when we are able to see each other's humanity. When we are able to talk about how to resolve a problem together, instead of focusing on who are you and who are you in all of these, who's the one who gives prescription, because the medical field, that's what they do. They give prescriptions. And in this case, we need to actually stop, go back a little bit, and try to create something that we as a community, as a model, can prescribe to other communities. I see a lot of potential here because I see those who are suffering the most being involved in a really beautiful way, and also empowered. So I know that we're going to be able to land this in other places. I just hope that everyone who's involved in this fall help us in any way that you can. Thank you.
Gerardo, you brought up a number of the ways this partnership is unique. Erin, from your perspective outside of Florida, would you speak to the uniqueness of it, and do you see it replicable across the country?
Yeah, thank you. I just wanted to start by kind of representation and what we do as a nonprofit at a national level. We really aim to support the health of farm workers and their families, and we do that in a variety of ways by providing resources, information, training, and technical assistance to community health clinics and universities and farm worker serving organizations. So I will be putting a link in a chat later because we have a robust team, and we really want to share what we have as resources to aid those who are doing the work on the front lines. So I just want to highlight all that my organization has done to kind of be a fountain of support and resource during this trying pandemic. And I think to answer your question, Laura, I think it's really important to start with health happens in a community and not a clinic. And I think that's something that I really wanted to start out with, because the community partnerships in Immokalee are very unique in the sense that it's like when collaboration meets crisis, and like what does that look like? And it's in a collaborative approach, and it involves like a broad set of stakeholders. And I think that's what's really important. Like you have your local federally qualified health center, healthcare network stepping in with their CHWs. They really bridged the community to healthcare. A global health organization that came in and brought testing and education when the state of Florida did not. And community anchors, CIW, and churches that have really worked together in conjunction with the clinic to increase the impact of outreach, and the local health department as well. So it's like all of these people together working to, provide multilingual responses and outreach in the neighborhoods, on weekends, in evenings, and common gathering spaces. So I think what really worked well is meeting people where they're at and doing everything that they can to remove barriers that are pre-existing to testing and vaccination. Because when the next chaos comes, I really hope that this model continues to be an example of how to tackle a crisis, whatever that may be, and pre-existing health inequities. So I think, what was really special, it's like all these people in the future, they should be paid for promoting health services. Those social support services that Jude and Gerardo were talking about, those are essential moving forward. And so I just want to commend your organizations and groups for being able to do this 18 months into COVID-19 pandemic. I don't know if that answers your question.
Gerardo, you mentioned about how right at the beginning, how high the positivity rate was in Immokalee, and we had reported that it was 6 times as high as the state, but also now the vaccination rate is actually one of the highest is in Immokalee. How do you combat fatigue in this long pandemic? What have you learned about vaccine resistance? What are you seeing? And how has your outreach impacted that?
Well, as an organization, we have established all kinds of relationships, because we use the framework of organizing when we realize that us simply saying we as an organization with everyone that participates with us are ready to do our part, right? To spread the importance of taking care of your health. And we did it in the same fashion that we do organize. So we actually had to change, to flip our approach, first thinking, well, naturally, we have been here since 1993 as an organization. We have all of these connections. This is going to be useful to be able to combat the spread of COVID. We thought that we were going to just like be embraced, in everything that we had in terms of connections to be able to push forward. For us, it was just a change in mentality and understand that we actually needed to fight for the resources that we didn't have, for the visibility. The word farm worker was not mentioned during the pandemic until May, you know, by our leaders in the state. And for us, that's just not the way to do things. When we were working with Doctors Without Borders, I think they mentioned at some point that it was 36 rate of positivity when they were testing a little sample. And I mean, 30% is just huge. This is not by chance. This didn't happen by chance in communities like mine. It happens because we have not addressed the situations that make people vulnerable. The lack of social support coming from the government in some cases. You know, we have a lot of H2A workers that are also sometimes afraid of speaking up or demanding the things that they need to protect themselves outside of the program. All of that, it's kind of up in the air. So I think that for us to overcome the fatigue, to overcome all of these obstacles, what has really made us stronger, it's to know that we are not alone. The partnerships are not only important in terms of creating responses to problems, they are also important for communities like Immokalee because we believe that we matter. If we're told we're essential and we live in Clewiston or other communities that are isolated, that are poor, that have no organization, and go and tell them all of these ideas, they are not going to feel the same, right? Because we as people need to be able to be taken into account, to be respected. So this is also about connecting at a human level in a way in which the humanity of people, it's part of their health and what we need to protect if we want people to participate with us. At the end of the day, you know, I mentioned the collaboration under the Fair Food program because for us, what we've seen in our experience is that people are going to do what their hearts want them to do. You know, as humans, that's what we do. So we need to find what is it that make people in our community participate more so that we can replicate those aspects. But more than anything, just make sure that people understand that we don't see them as hands to do the job, you know, as people that are incapable of crafting a different reality for themselves, because we have already, before all of this pandemic, we already had crafted something different. Now it's about health. And for us, you know, we use methods of popular education, drawings, going to the trailer camps, and talk about all of these issues in regards to health. The promotoras have been doing an amazing job. Us as a community have been basically flipping the job that we used to do in human rights, focusing on campaigning, focusing on bringing more buyers to be part of this, which is something that we're still doing. But we actually had to flip it. 90% was work on human rights, 10% it was around health and issues that impacted the community like that. But with COVID, we flip it. Now our work is 90% COVID, and we need to come back to keep fighting to improve our conditions so that we are eliminating at the same time the vulnerabilities that continue to be part of the workplace.
And for what you've built, now the question is making that sustainable, right? And how do you make community health models sustainable when those are based on healthcare funding rates that are based on reimbursement systems? What will sustainability look like here in Immokalee?
I guess that's a question that we all need to think about to be able to respond. I mean, resources are needed. There's no secret that Immokalee is a poor community, one of the poorest communities. And that's why we need to keep fighting to be able to, you know, bring this message across the nation. I mean, this way in which sometimes we're perceived, you know, it is as workers at the bottom of the economic ladder sometimes, and we're also architects. We are building something here that I think just needs the support of everyone, but in a way that is also respecting of the community, you know, in a way that the full humanity of the people who made it possible for food to end up in every hospital and in every home, for every recovering patient. It's possible thanks to us, and it's not magic, it's hard work. So it needs to be respected as such.
Jude, you want to add to that?
Yes, I would like to add a few words on that. And from my experience with PIH, working with many underserved communities, often that you realize that you can only focus on the work you have to do. And as a physician myself, again, it's good to plan, to think how you're going to make this to make this last. But most of the times, the need are so fragmented, so evident that you can just put.
Did he freeze? Erin, let me, while we get him back, let's kick over to you, Erin, because you had some thoughts on that.
Yeah, I really wanted to hear what he had to say. I hope he is able to join us later, because I definitely think his insight is invaluable. I think this question I thought about a lot this morning, and I think kind of what Jude was talking about as a physician and kind of the focus of like what needs to be done. We really need to shift from fee-for-service to value-based reimbursement, because the way it's set up currently, providers are getting paid for seeing patients regardless of the clinical outcome. So the focus is on service volume and less on quality care. It, you know, balloons healthcare costs and doesn't encourage preventative care or value-based care. And so shifting funding models to really move to like more holistic ways of payment that allow clinics to kind of budget for things that are more whole human services. It would be a shift from volume to value. And I think part of that has to do with putting money into social service support systems. I think that is something that is really important. And I touched on earlier. So how can clinics kind of get reimbursed on value, not fee for service? It's not an easy task.
Hey, Julie, you had mentioned that what's going forward for your organization, you are expanding the areas you're expanding into in the grant. Obviously, grant funding is different than reimbursement funding. What do you see for the future and how you can grow?
So until that funding model, as you've talked about, changes, we're using grants, we're using philanthropy to continue the outreach work. We're funded now for 2 years with the current so we're funded for a couple of years with a federal grant for the COVID team, and we've received additional funding to expand into new communities beyond Immokalee, other at-risk communities, providing what Erin talked about, which is taking healthcare to the community, taking it to the neighborhood, going home to home, and offering what essentially is care management or case management for especially individuals with chronic conditions, and getting them connected to, during the crisis, we're connecting individuals who test positive to social support and other services. We've really gotten to know all of the resources of the community. If somebody needs food, if they need a medical referral, if they need transportation, we're able to surround them with that social support. That's a model we're going to continue. Our organization, Healthcare Network, is committed to it, and we will figure out ways to pay for it over time. But again, right now, between philanthropy and grants, we're sustained for the short term, and this is the right way to provide care for these communities. Take the care to them.
Tell us where you're expanding to in this area.
We're looking at the vulnerable, underserved communities surrounding Golden Gate, Everglades City, Chokoloskee, East Naples, some parts of Naples, even the downtown area where there are pockets of individuals who often are the groundskeepers, the working for construction at the hotels. They're not paid a lot of money, and yet they need healthcare, and we want to connect them to primary healthcare. That's one of our specific goals. And if we can take care of them in whatever conditions they have, we can keep them out of the emergency department, and we can keep them out of the hospital, which our health systems would be happy if we can take care of them in their community.
Tom, have we gotten Jude back? Has he come back in?
Not that I can see.
Okay, I hope we get him back.
Yeah, I reopened the room, so I'll keep looking.
Oh, here he is. Hooray. Jude, can you hear us? Jude? It looks like he's connecting right now.
Yeah, he is. Julie, if you would remind people if they have questions to submit them in the chat room in writing.
So reminded.
Reminded.
Yes, we could take some questions in the chat box. I don't see any in there right now. So please submit your questions in the chat box, and in about 7 minutes, we'll start the Q&A. Laura, continue, please.
Well, let's go back to Jude. Jude, can you hear us?
Yes, my apologies. Technology problem. I don't know what happened with my computer. So
we're great to have you back. We'd love to hear from you.
Yeah, I'm sorry for that. I was saying that being a physician, oftentimes what you can only do is providing care. For sure, it's good to plan, but the needs are so important around that you can only hope you do what you got to, and then your work by showing what you're doing, advocacy, we will join the good fight. So it's to say we have to make it sustainable, and we should not let the fear of not being sustainable prevent us from going to the extra mile. I am a young practitioner, and I can tell you so far, most of what we've been doing, if we were to think about sustainability from the beginning, we would never have done it. So it's up to us. We are our neighbor's advocate. We are our patient advocate. So it's up to us to do the advocacy to make it sustainable. Over to you. Thank you.
How about around each one of you, what's one thing you learned as you built this partnership that you didn't know before and that you're going to use going forward?
I think from my perspective and healthcare network perspective, the trust factor in a community like Immokalee is incredibly important. And in the early months of doing door-to-door canvassing, it felt like we were outsiders and not necessarily well received, but with the support of the coalition, with help from Partners in Health, with the Promotora training, over time, people began to recognize team members in the community and would come to them asking for assistance and help and wanting the testing and eventually wanting vaccines. So trust in whatever community you are in is absolutely crucial. And to build that trust, you really have to have those strong partnerships. Everybody needs to play a role. You need to be a little flexible. I guess I've learned a lot of things, and it's been an incredible journey, and we have so much more to do.
How about Gerardo? What did you learn that you didn't know before?
Well, I learned that it is possible to step into the health arena with a crisis in hand and find good people to be able to work together to address the issues. I'm really grateful that we had in our work some of those, the results, like how beautiful it is when things can be coordinated like that with a single effort in mind, but with a lot of people trying to do their part. For us, what I learned also is that it's how important it is to also think about the ways of the community and how our contribution is helping to be able to see practices that can be then replicated in other communities. And all of it speaks to one really important thing to me and to our community, which is our value as people. And that is what I think drives the participation. That is what builds trust. So for me, I think that we need to bring all of the experiences that made people want to get close to these vaccination sites, testing sites, and to ultimately take care of themselves, but having all the things that they need, the economic support, the information they need. I see that somebody was asking about how we combat misinformation. Well, all of these partnerships have given us what we have been able to do. With the radio, for example, we established a collaboration with Migrant Clinicians Network and bring experts to talk about the psychological aspect and impact of COVID in the community, to talk about the misinformation and how it works and how to combat it, to talk about the importance of recognizing that our families are waiting for us in our home countries when people come their age to age and they want to see us healthy. Making those connections for us have helped a lot. And that is my lesson. I think that we need more of that. We need to drill down and everything, just pull out everything that makes people in communities of vulnerable workers realize, we're important and we are sustaining something here and we want to collaborate to be safe.
Thank you. Hey, Jude, let's come back to you. Just what have you learned? What has your organization learned? And also, have you combated misinformation?
I think what I've learned is collaboration, partnership is key. There are so many things to be very efficient or effective in what you're doing. Collaboration is the key, and because by having the team, there are so many insights that you need to do what you're doing. Collaboration is very key. So that's why we are so grateful to have partners like HCN, CIW, Mission, and Peniel to help us in this good fight. How do we combat misinformation? In my practice, I think for me, the best strategy is one of the best is to try to make yourself in the shoes of the other person. Try to not judge or misjudge them. Try to understand why they are hesitant. And just here, I think I have at least 2 patients or 2 people who came for testing. And at first, they refused categorically vaccination. And I talk to them and they tell me why. We talk about it. Trust me, before they leave, they ask me for the pamphlet to know where they can go get their vaccine. So it's first is try to understand them, try to understand why they are hesitant, and keep sharing information with them. Just that, keep sharing information. Do not try to push anything on them, but keep sharing. They can ask it as many times they want. Just be patient and keep sharing information, not misleading or leading information, but just information that are available so they can make up their own mind, but be ready to answer question they may have. Thank you. Over to you.
Thank Thank you. And there's a question about, can you elaborate on how the government didn't recognize migrant farm workers until May? And that was this year. I did put a link in the chat to a story that Janine Zeitlin wrote, and also mentioning that I have at the top of the chat. This conversation stemmed out of the work that they were doing, and then the work that Janine Zeitlin and Andrea Melendez did in an article that was posted last month, both a documentary and an article on this partnership, which was part of a USA Today network series of stories that came out on justice in healthcare across the nation. So who'd like to answer? Probably Gerardo, right? You want to elaborate a little bit more?
Yeah, it's what I was mentioning in regards to, you know, when all of this started, we basically canceled a big action that we had on the campaign for fair food to then start organizing in the community, and it took since we started since April, I think, having this conversation, and then on March, we were starting to think about how to respond, you know, but we didn't hear anything until May. The word farm worker, that's the reference I was making. When all of this started, was not mentioned by the governor until May, close to May, when there was announced, it was announced that testing would be made available. It didn't work out as it should have because they were still trying to figure out how to bring the results, and it took like 2 to 3 or 4 weeks sometimes for people to receive a call with the results, which defeated the purpose. That was May. That improved, you know, with the participation of Doctors Without Borders, but ultimately, you know, the government has been very distant from communities of essential workers in the country, you know, because there are many vulnerabilities that need to be addressed. And I think that it's again a matter of how much a farm worker is valued in the eyes of politics. I think that that's going to depend on how much we elevate those lives in the public arena to be able to then bring these questions to the politicians that need to act and protect their communities.
Think about the systems. I'm sorry.
No, go ahead, Julie.
Think about the systems that were in place when vaccines were distributed in January. This speaks to it exactly. So in Immokalee, vaccines were going to be available. You had to get on a computer, you had to make a phone call, and you had to wait for a long time to get a slot. So who showed up in Immokalee to get vaccines? No one from Immokalee, because they couldn't. They were out working, they were in the fields, they didn't have computers, they didn't even have transportation to get to sites to get vaccinated. So the system was set up for not the people we're talking about today. This what we had to do, and Coalition of Immokalee Workers and Partners in Health and Healthcare Network and others personally made connections with people, got them on lists, and we brought vaccines in and gave them vaccines to the people who we signed up, the local community. It's a very different model than what everybody else is used to, and you have to think in terms of the community you're serving.
Mm-hmm.
There is no hospital in Immokalee. In the past, has there been efforts to get that? And how would that change healthcare delivery?
It would be a game changer, you know, because we don't have the infrastructure that's needed to respond to just basic things. I mean, if we have an emergency, what you do is you get to Naples, but then you have to think about being poor, not having access to transportation sometimes. And yeah, being 40 to 45 minutes away from an emergency room, or having something that's closer here in Ave Maria, but a little bit less, with less access, you know, for people. It's smaller. We need to have the infrastructure. This conversation cannot happen on a vacuum as a response to horrible situations that are taking our lives and the lives of our community being placed at risk. We can't. Our contributions are so important that they need to also have a response that is at that level. If we are going to sustain the country with our job, if we're going to feed every person, the least that we should have is infrastructure to protect our health so that we can continue to do that in a dignified way. And for that, we mentioned this from the very beginning. We need to think about a hospital. Our community is in a very vulnerable situation. And that was met with really not an answer, no interest. We need to talk about those things and think about long term,
Here's a question in the chat or just comment about it. Would have been nice to be able to hear from people that you directly helped on this call. You can see some of those in the reporting in the story that's in the chat. Why don't Julie, Jude, Gerardo, if you can give one example that has that was impactful to you or someone on your team as they watched a life change because of the help you brought.
One of our community health workers, promotores, is Osman. Osman speaks very little English. He speaks Spanish very well, and he is so committed to the Immokalee community. He's the one who often gives the test results when we do the rapid testing, and he will also call and visit people who have tested positive to make sure they have their resources. And if they've gotten a pulse oximeter to measure their oxygen level, how are they feeling? What is the level? Just making sure that they're doing what they're supposed to be doing, and then connecting to them to medical help if they need it. He visited one family and got the entire family was so supportive because they credit the COVID team and the work of our partnerships here with saving the life of the dad in the family, because he did have issues. He was given medical treatment. He went to a doctor. The doctor said, "Thank you for coming when you did, because you would not be here if you had not come and gotten the help that you needed." Those are the things that even after the community health workers are working late hours doing testing and exhausted, those are the things that keep them going. You're talking about how we take care of ourselves and get through the fatigue. These are the success cases and the good results that people need to hear and want to see.
Anyone else have an example of something that stuck out to you? Someone who really touched your heart or that you touched? Or anything you'd like to add about if you had a wish list for if we could just have this in the next year? Also conscious that we've got migrant workers coming back into town, within next month or two?
All right, I have something. We're recruiting additional community health workers. We need them to be from the communities that are going to be served. If you have people who care about their community, they don't even have to have experience, but they just have to be passionate about helping people. We'd love to have them join the community health worker team working in this partnership with us to outreach to more individuals in Collier County. So if you know people who fit that description, let us know.
And I don't know if that can help with the giving idea on how we help. I know so far we give through Mission Peniel. We did cash transfer to families or patient or people who were tested positive. I believe it was 400 per patient, and then 800 with a cap of 1,200 per household. I would not say household, because there may be several family in one household, so it was a cap of 1,200 per family. So this can speak to direct support that we have been provided, or we provided to people during the surges, the COVID-19 surges.
I think an example of, like, when I think of continuous care and how the community organizations work together, I think of how the implementation of an ROI with the church, once someone tested positive, it's like connecting them to the support services and the financial assistance that they needed. That's like helping people stabilize their vulnerabilities. And for me, that's like continuous care during a pandemic. It takes the whole family approach. And I think that that is so important to have those social support services in place. So when I think of your community, I think of continuous care when combating the COVID cases. And, you know, we all know that farm workers are vulnerable to other infectious diseases as well, like tetanus and seasonal influenza. So how do you keep this going, you know, like beyond COVID? How can this collaborative approach continue?
And Laura, we're running up on our time.
I think just hand it back to you, Julie, to wrap it up. And thank you, all of you, for this discussion.
Yes, Gerardo.
I just want to say thank you so much to everyone for inviting us. One of the things that I want, you know, for all of us to take with us, it's for all of us to bring the question, you know, what can I do for those who fit me? How can I be, you know, an instrument of support for communities that are actually giving everything and risking everything? I think that this is a beautiful response. You know, these collaborations need to be replicated. So thank you very much for having us.
Thank you. So let's all thank Laura for being our facilitator. And thank you to Gerardo, Jude, and Erin for being panelists today. Really appreciate the conversation. And if there are ideas about ways we can continue the conversation in other ways, let us know. If you are not a Press Club member and would like more information about becoming one, check out our website. And that's also where we will have the recording of today's program. Give us a couple of days to get that ready. We'll also try to send that out via our newsletter, our mini scoop, which Carla manages so very, very well. And members and guests, you're also welcome to join us for an in-person meeting. Erin, probably you'll be in Texas, so you can't join us, but everybody else is welcome to join us for our in-person meeting on December 2nd. It's a Thursday. We'll be at Seasons 52, and Jill Jaffe, our program extraordinaire person, has put that together for us. So we look forward to getting together. And thank you, Tom, for hosting us, and Carla for doing all the registration materials. And again, thank you for joining us today. It was great to see everyone. Enjoy the day.
Thank you so
Thank
much.
you.
Bye, everyone.
And happy to come back
Have a good day.
anytime.
Oh, great. Thank you.
Bye.
Bye-bye.